everyone. Welcome. My name is Epi Budvig, and I'm the founder and CEO of Bold Words. Welcome. Good evening, good morning, good afternoon, where you are in the world. Looking forward to this great virtual event that we do it from time to time with as part of Bold series. Brief history about Bold Words. Bold is our annual innovation program that we launched together with H Farm late in 2018. With over 33 categories, this program is better known as the Oscars for Digital Industries. We're now accepting submissions for sixth edition, and you can find out more at bold-awards.com and how to submit your project and company. Feel free to reach out to our team members here, and they'll be able to share the link. First, I'd like to thank all of you for joining us today, including our esteemed speakers. This is our second Bold Series virtual event of this year. We've done over 40 virtual events similar to this since we started Bold Words. The topic for today is virtual vitality, exploring VR innovations in healthcare. Today we have the following guest speakers presenting in this order. Richard Vincent, founder and CEO at Fundamental VR. Veena Somareddy, founder and CEO at Neuro Rehab VR. And Hossein Jalali, co-founder and CTO at Virtual App. What to expect today? First, we'll start with Richard, then we have Veena and Hossein. After that, at the end, we'll have an open panel so we can ask more questions as part of a debate. A little housekeeping here before we get started. Any questions you have, please put them on the chat section below. Clive Rafael from our team will be moderating all the questions, and we bring them live to the open panel at the end. Thank you for submitting your question ahead of time. We truly appreciate your enthusiasm for this event. Also, feel free to share your profiles and connect with others in this chat box below. We want you to maximize your time and dedicate some good ample time for networking. All right, so where do we start in this order? Obviously, when we pick certain topics, we pick these topics because we want to make sure that we're also picking up on the trends and where things are heading. And so the virtual AR world after AI is such a very important stage at the crossroad where we're seeing innovation and an accelerated speed. And we thought this would be a great opportunity to bring this topic, especially in the healthcare. I mentioned a little bit of bold words, but this bold edition, after 5 years being in Venice, we made a decision to move this in Lisbon, Portugal, and partner with some great partners in Lisbon, such as the APDC and Unicorn Factory Lisboa. That brings us to our sixth edition in Lisbon for our award ceremony on March 28 and 2025. And so we're really excited for this. There's a lot of things are happening in Lisbon, but for this particular topic, I want to just for all of us to pay some attention to where is this space in right now. And we thought we bring some great speakers who are truly the pioneers in this space. We are truly moving from headphones to a AR a VR world, and certainly it seems strange in certain ways, the way how we use these gadgets, the way how we're behaving with these gadgets. But you must understand that between the virtual reality and augmented reality, there's also mixed reality in this stage. And what we want to focus today, we want to focus on the area where VR is in healthcare. As you may know, in terms of the gadgets, Quest 3 from Meta, Facebook, they've been able to sell over 30 million of these Quest 3s, and when Vision Pro started their sales in early this year, now they're about 500,000 gadgets sold. This means truly there's a massive commitment from these two gigantic companies who are truly committed to redefine the space of AR and VR. So truly exciting for this. When we look at the space itself in healthcare, we're looking at four ways of virtual reality is transforming this space. One is obviously surgery streaming, and there's a lot more that we're going to cover with Richard from Fundamental VR, and that's the reason why we want to have him first joining in this Bold series. Then we have about the anxiety and pain relief, including treatment and phobias and embodying patient perspectives. This truly resonates with all of us. We all have someone in our inner closed circle that are certainly like affected by the certain illnesses that truly causes certain pains in this space in this area. And so I think for us, what we want to do here, we want to first see what's out there, bringing us all these great pioneers in this space, and also showing us what they're doing in this particular area with their solutions. So I'm truly excited to have first as a speaker here Richard Vincent with his the transition to digital surgery and advanced practices with his platform. But before we get started, I'd like to just give a bit of background from Richard. Richard brings about 20 plus years of experience in building international businesses and has, throughout his career, sought opportunity to positive market disruption throughout technology applications. It was this desire that led him to co-found Fundamental VR to help address an age-old problem for medical market, how to create safe, realistic, measurable spaces to learn, train, and develop skills. In role as CEO, Richard is responsible for building a world-class team of medical learning and technologists who together can realize the company's ambition of creating the world's first global haptically enabled low-cost platform. Richard, great seeing you, my friend. Welcome to our Bold series and looking forward to our presentation. I'm going to share the screen for you, so let me know when you're ready.
Great, thanks Epi, great to be here. Let me just turn on my video and hopefully that's all coming through okay. Yeah, delighted to be here. Thanks for the invitation. And
thanks for joining.
Pleasure. So as Epi said, I'm the co-founder and CEO of Fundamental VR. We've been in the space of spatial technology, virtual reality, mixed reality for about 9 years now, building out our platform, Fundamental Surgery, and addressing, as Epi kindly said in the introduction, an age-old problem, which is skills transfer, skills and training and education within medicine is difficult. And we believe that with the digitization of and the use of spatial technology, we can help to change that situation. Next slide, please, Epi. As a business, our vision really is this. It's moving towards a world where we have what we call pre-human competence. And what I mean by that is the idea of being able to achieve a level of competence, confidence, and capability away from a human being, whether that's a specimen in the sense of a cadaveric specimen, which is where a lot of existing training happens, or a live patient, which is where most hands-on experience is gained. It's tightly controlled, but it comes with its own inherent challenges and dangers for both patient and for the healthcare provider. So we're striving to really create pre-human competence. So in simple terms, don't learn on me, learn on a simulation of me, and then move into the OR with a much higher level of competence. I'll break that down a little bit more. Next slide, please. Yeah, thank you. So the strategic problem as we see it, and we've been setting out to try and address in the market, is really there's complexity, lots of complexity coming through. The transition to digital surgery is really advancing at a dramatic speed. Now, digital surgery, by that I mean all of the cutting edge advances. So think robotics, think image guided, interventional, minimally invasive, all of these new cutting edge technologies that are being deployed in the operating room, which are great for improving patient outcomes, great for recovery levels. All of them have one common problem, which is learning how to use that technology. It's moving really fast. It's moving incredibly quickly, and achieving competency at scale, i.e. across a collective of healthcare providers, is incredibly difficult. In fact, it's the number one friction why things don't get adopted at the speed we would like them to, and why practices take longer than you'd expect to be adopted. And if we can have the next slide, please, Epi. And that is because of that complexity that I just talked about. The image you're seeing here, which is just a grab from one of our simulations, this is illustrating a simulation of a type of cath lab. You can see the variety of equipment here. The software that's being run on these is incredibly complex. The interdependency between different systems, different hardware, different vision capabilities, different scanning capabilities, means that realistic opportunities to really rehearse and understand how you use all those different elements together is very hard to come by. And so finding an environment where we can provide the opportunity to have massive repetition at your convenience as the healthcare provider is, we think, incredibly important. And it's this complexity that is causing that hold up in competency at scale. So next slide, please. So for us as a business, we're really about being an acceleration multiplier. So using the technology of spatial capabilities, which I'll talk a little bit more about in a second, but in simple terms, immersion into a virtual space combined, where appropriate, with haptic technology that delivers the sense of touch and force feedback, providing that capability to digitize that learning experience, to take it away from or to augment traditional training approaches, so didactic training and cadaveric training and wet lab training, providing that within a safe virtual space. And the platform that we've built with Fundamental Surgery is really completely agnostic. It's agnostic to discipline. So you can see some examples here of different use cases. On the left, anesthesiology. In the middle, some robotic, some cardiovascular, and on the right, some nursing. It's completely agnostic to procedures. It's completely agnostic to hardware. Hardware comes and goes, so knowing that you've got a capability to plug into the best headsets, the best haptic systems is important. And it's completely agnostic to location because it's completely virtual. And it's those three things really that allow us to start to create acceleration in the learning curve, both because of the way you're learning, but also because of the opportunity to learn, the opportunity to dive in and use these simulations in a way that meets with the healthcare providers and the clinicians' work schedule and busy, demanding lives. Next slide, please. So the platform that we have, Fundamental Surgery, is really made up of a number of key components, and you can see a little bit of it illustrated here. And I won't go through this in too much detail, but just to pull out the key points. Firstly, we have multiple immersion options. So we have the ability to put people into what we call a standalone virtual reality environment. So this could be a simple low-cost headset like the Meta 2 or Meta 3, Quest 2 or 3 headsets, very low cost with simple haptics or hand tracking that allows you to really understand the three-dimensional environment you're within, the patient in 3D, and to go through procedural understanding. So understanding the anatomy, understanding the steps of the process. Great for early stage learning, brilliant for medical students, great for residency, and really helps you to understand and get the knowledge of learning. And what we've seen in validation studies done across the market, not just our own and or connected to us across multiple different providers, is that this standalone VR capability can increase the knowledge acquisition by somewhere between 100 and 250% versus traditional training techniques. So incredibly powerful. But it tops out at a certain point. It gives you that procedural walkthrough, but if you want to get hands-on experience and you want to start to learn how to actually do it, as opposed to just the process of doing it, so actually hands-on, then you need a next step up in immersion. And that's where we bring in our virtual haptic VR system, as you see illustrated in the bottom left of this slide. This has everything that the standalone system has, but now we bring in the sense of touch, of weight, of resistance, of force feedback. So you can build the muscle memory. You can start to feel what it's like to get it right and to get it wrong. And you can try, you can deliberately fail and understand the different techniques, whether you're using in the image here, a virtual what would be there? It's a virtual syringe and scalpel, or whether you're using a virtual robot, or whether you're using a virtual interventional device. All of those things can have the sense of touch built in, so you start to understand the resistance that the body will give you as you go through that process. And all of this, whether it's standalone or haptic or both, can have collaboration built into it. And this allows us to really just break down time and space. So we can put people together irrespective of where they are in the world, not like a Zoom call, but like actually being in the room. So you have a sense of presence with all of that. And those three different elements deliver an enormous amount of data. From that data, we can infer and understand behavior, outcomes, actions, etc., and start to build up using our machine learning algorithms and our AI systems. We can start to A, give feedback, B, give results, and C, predict what's going to happen. So we start to actually get in front of the movements and the behaviors you have there. So it can be really powerful. And then we plug all of that into our AI system and bring in a chat bot, such as the one you see here called Maya, which I'll talk about a little bit more in a couple of slides. But this gives you physical interaction with an expert. So a full rounded solution, depending on how we want to use it in any particular scenario. Next slide, please. What this delivers, all of these different things, is really 4 different areas. So the first one is situational awareness. It's incredibly hard to get into the right room with the right expert at the right time to learn. This breaks down all of those barriers, and it takes away the travel requirements, it takes away the logistics requirements, it takes away the need for restriction of the number of people in that space. We could virtually fill this space with 100 people, 500 people, or we could have it just as a one-on-one example. So it gives you the ability to be there, to see it, to experience it, to go through that process and to understand the dynamics going through that procedure. You know, if a learning curve on a procedure is 50 cases, it might be that you can run 40 of those cases in this virtual space in a couple of days. It might take in the real world months to get that experience. So it can really move that dial much, much faster. So situational awareness is really key. Next slide, please. The next thing it delivers, as I was touching on, is that idea of force and the effectors. So by placing in your hand physical items, and you can see here a couple of examples of one of our partners who make the hardware here, Happily. Here we're holding a Happily device. In the virtual space, that device becomes a scalpel, or becomes a needle, or becomes a syringe, and you're able to then interact with the patient, and your brain fills in all the gaps to allow that feeling to be as convincing as you need it to be to learn the muscle memory you need to do that particular procedures. Now, in some cases, in the one in the center of this screen in ophthalmology, those haptic interactions can be very, very subtle, but they're really important. In other areas like orthopedics, they're big gross movements, but again, equally important to understand the precision. So force and effectors come into play when we bring in the haptic capability. Next slide, please. And the telemetry that comes out of all of that, we know where you're looking. If the headset allows it, such as the Vision Pro, we know where your eyes are looking, we know where your hands are, we know the efficiency of movement. And from all of that data, we can really start to understand how you're performing, how your learning curve is progressing, and we can give you real meaningful feedback on that. Next slide, please. And the final one here really is the fourth piece, which is taking all of that telemetry, all of that situational awareness, all of that force information, and bringing it into guidance, advice, knowledge, and expertise. And what I mean by that, just at the top level, is having access to the experts because they've in effect been digitized. We put their knowledge, their teaching, their learning, the information about the equipment you're using, we put it all into a very constrained language model. We put a text to speech and a speech to text bot on it, and we've called it Maya, and it allows you to talk with that bot while you're in the procedure and get advice on your interaction, on what you do next, where you should go. That bot can also, and it can manifest itself in any form, it just happens to look like a kind of robot in this particular one. It can also step in when something starts to look like it's going to go wrong and offer you advice. And what we've found from the analysis we've done with the procedures we have in place is we can get really quite accurate about the performance based on the telemetry data, particularly in haptics, to the point where we're seeing now with some of our simulations our ability to predict the outcome up at like 98 to 99% certainty. The pathways of an expert versus the pathways of an intermediate versus the pathway of a novice, we're able to see all of that in real time and provide that back to our users and back to our system as part of the learning and education. And all of that, again, helps to accelerate that adoption and that learning curve movement. So that's an overview of really what we're doing. And next slide, please. I think that's probably the final one. Yeah, as an overview of what we're doing with fundamental surgery and the use of VR and spatial technology for this important part of training and education. Epi, back to you.
Fantastic, Richard. This is an amazing presentation. A quick question: on a haptic area, is there what's the latency? Is there any latency on that one, and how that's being approached today?
Great question. So latency is a really big issue. You have to have less than 1 millisecond latency to have non-disruptive haptic force feedback, which we can achieve. We can do it through our system, no problem at all. So to the human, it's zero latency that you will be seeing there. And the fidelity, because we're sub 1 millisecond, is really strong. It's a really strong haptic interaction.
Interesting. Clive, do you have any questions for Richard?
Yes, hello, Richard. There were some questions received before hearing you talk today, and I guess you've pretty much covered it, because the question was, how do you ensure the realism and accuracy of the VR environment? I mean, that's what you've just presented to us about. So perhaps I'll just go straight to the next one, which is what challenges remain for you?
Great question. So just pick up that first one, just to round out on that one. We have an extensive body of key opinion leaders, medical and surgical experts who guide us through all of that to make sure that we have pin perfect fidelity and capability there. So that's an important addition. You know, this is about surgical knowledge impartment. So we have to both the knowledge and the physical skills. So we bring in the experts to help us with that. And digitize their capability. What are the challenges in front of us? Well, yeah, haptics are incredibly difficult, and we continue to fight and push that capability as hard as we can. The interoperability around different headsets, different software, different vendors. We're obviously one for end healthcare professionals and industry users is a challenge for the industry, making sure that we're using common standards so you can get that interoperability. That's probably the key one there. Everything else, you know, Moore's law is applying. Things are generally getting cheaper, faster, and better. So that all helps the adoption of this.
Great, thank you. Thank you.
Richard, great seeing you, my friend. Stay well, always be bold, and look forward to seeing you next time again.
Thanks, Epi. Thanks for inviting me into this.
Thank you. Appreciate that. All right, moving to next speaker, we have a Veena Somareddy. She's the CEO of Neuro Rehab VR, a VR healthcare startup aimed at the building virtual reality therapy exercises for physical therapy. Her Her accolades include being recognized as a top innovator in North Texas, Fast Company's World Challenging Ideas honoree, and featured in Forbes PBS History and Future Series and Cosmopolitan. She's also receiving a National Science Foundation grant and one of the 10 startups chosen to participate in the first Amazon healthcare accelerator. I didn't know that Amazon have an accelerator program in healthcare. Using her many years of research and development experience in VR and AR, she's helping to connect technology and healthcare to enhance patient care and rehabilitation outcomes greatly. Vina, great having you here and look forward to your presentation. Let me know if you're able to share your screen.
Well, thank you so much for that introduction and, making us part of the Bold series. So I appreciate that. I will share my screen. It says I cannot share screen while the other participant is sharing.
Let me figure out first. Hold on 1 second, and we'll get to that. All right, Vina, change. Okay, are you able to share your screen now? Hi, Vina. Vina, are you able to share the screen now? Yeah, I can see it. Great. Can you hear us?
Okay, I'm back. Sorry, I thought I was. You could see me. Can you see my screen?
Now we can see you, now we can hear, and we can also see the screen. Thank you for joining us.
Okay, perfect. Yeah, thank you again for inviting me to give this talk. And Richard, your presentation was amazing. So I just wanted to go through the work that we do at NeuroRehab VR today. So as you know, I'm Veena Somareddy, the founder of NeuroRehab VR. We started about 6 years ago inside a neurological recovery center where we saw a lot of patients who have had strokes, brain injuries, spinal cord injuries, MS, Parkinson's, and also kids with cerebral palsy, spinal cord injuries, ADHD. So we had a whole range of patients that used to come to this clinic, and we had the opportunity to actually build our therapy applications within this center, which really helped us create the product we have created today with that feedback loop we've had from patients and therapists from day one. So here today, I'm just going to introduce the work that we do and how virtual reality really helps with neurological rehabilitation. Each year, millions of Americans need physical therapy after suffering a neurological incident or a musculoskeletal injury, and the global scale is much bigger throughout the world. And this is one of our patients, Joe. His stroke really left him paralyzed on one side, and he couldn't really move his fingers. But when he scratched his head on the right side, his hand used to open up, which said that there is a connection between the motor cortex and his brain, but he really needs to tap into it. And that's where physical therapy and cognitive therapy comes in. In the US, at least 800,000 people in the US suffer with a stroke each year, leading to long-term disability and not being able to get back to their normal life. And that's what we really want to change. And we heavily use the concepts of neuroplasticity while we are building our applications. It suggests that your brain does have the ability to recover from a stroke or a brain injury. That is, the healthy parts of your brain can take over the functionality of the damaged areas, but really requires extensive physical therapy and cognitive training. Moreover, right now, since we're in the US, these are some US-based stats. There are only about 74 physical therapists per 100,000 Americans, but the number of people who are growing 65 and older is growing faster than the US population. And by 2060, about 30% of the US population will be 60 and older. So there is a real need for scalable, effective solutions that can be accessed from anywhere. And that's one of the reasons we build virtual reality therapy applications. And as I said, we work with the whole range of patients with different functional abilities. And we have created a suite of exercises for upper extremity training, lower extremity training, core control, fall risk, as well as balance, stress and anxiety, and some cognitive skills. So now we are able to provide a turnkey solution to any clinic that really wants to use virtual reality for the patients that come in. So we've also tried to make it really easy to use. Setup when it comes to setup time, it can be used in conjunction with other therapy equipment that the clinicians may have at their center. So just to show you, our XR therapy platform is FDA registered medical device, and we've seen that gamified therapy is highly engaging for patients and providing a new therapy modality for our clinicians, especially as the number of patients are that they have to see is growing more and more every day. They are tired by the end of the day, but with VR, what we are providing is this tool that they can use to work with the patient on any experience and to reach their goals without thinking much about how do they creatively engage that patient for that 1 hour they might have them during therapy. And there is a vast body of research that shows that virtual reality is really effective for physical therapy. And we always look at the literature reviews before we build any new therapy exercise. We're also very excited that CMS, that is Medicare, came out with a code just for VR in the US called 0770T, which our clinicians can get paid for using virtual reality in their sessions. We've also built a HIPAA compliant platform so that the patients can track and their progress securely. To just kind of dive into the difference in using virtual reality in your therapy sessions versus going through traditional therapy, there is automated acquisition of data. So we are able to collect data on their movement, their range of motion, the progress that they've made from their previous session, and really quantitatively show the patient that the changes that they've had. Because with a lot of patients that we work with, they've been in therapy for years and years, especially chronic patients, and they've most of the time given up or plateaued. But when they see that even a little bit of movement change or progress that they've made, that really gives them hope that they can get better. So the automated data acquisition really helps with that. And like I said, patients get to see in real time how they're changing. And as I said, one of the things that happens with a lot of patients that we work with, they have some kind of pain, shoulder pain, hip pain, or they could be depressed. And there is a lot of research that shows that VR can decrease pain, and now they're able to get through their therapy session. We get to hear a lot of stories as we're going through this, and one of our recent customers were telling us how they had a patient with high blood pressure, and whenever she comes in, sometimes they're able to do therapy, sometimes they're not, because of her high blood pressure, they're not able to get through the therapy session. So they use our device to actually bring down the person's high blood pressure to an optimum level by using some of our relaxation and stress and anxiety applications. And then we're able to get into some of our mobility-based therapy exercises and actually complete that therapy session for that patient, which is really powerful when, when some of these patients aren't able to do that. So we've seen a lot of really good outcomes with our patients. They're more engaged, they're motivated during their therapy sessions. With our data analytics system, they're able to precisely track their progress along with the therapist. And we've seen, a lot of increase in range of motion for our patients. They're able to balance better, decreasing fall risk, especially for our elderly patients, which is really, really important. And then better muscle coordination and decrease in sway back. And sometimes they're having so much fun in virtual reality, their cardio is getting better and they're staying in therapy for longer periods of time. And that's what the clinicians love too, because when the patient comes in, especially an elderly patient, sometimes they get to do only 5 minutes of therapy before they need to give them a break. So they're really not able to get as much therapy out of them within that 1 hour that they have with the patient. But with VR, they're having fun, they're staying in longer periods of time, their cardio is getting better, and all of this in the end is leading to better functional independence and a happier life for these patients, and that's kind of always been our mission. And one of the things that we started to add in with the applications that we're working on is a certification pathway, which the clinicians are really excited about. As we started to bring on board more and more therapists on our device, we wanted to make sure that they feel confident using a virtual reality device and they feel that ownership on that device when they're using it with that patient. So we have certification programs that they can go through and become a certified clinician. And we've had many of them add this as a skill as they're working on VR therapy. We also have customized therapy plans as we started to add more exercises to our platform. We had clinicians ask about which exercise do they use with patients. We also provide customized care plans depending on the diagnosis of the patient, which has been great for the clinicians to have a baseline plan before they jump into higher level plans with our patients. So we work with a lot of top tier health systems all across the US. One of the reasons that health systems love our device is, better patient engagement, which leads to better compliance because that is an issue in physical therapy. If any of you have been to therapy, not everybody is excited about it. So having this really brings those patients back and reducing readmission, especially for bigger health systems. If the patient is readmitted, they do not get paid for taking care of them. So for making sure that the fall risk is decreased as much as possible for the patient is really, really important. And we also work heavily with the VA. We recently also received a contract with the DoD to work with the Air Force to help with spatial disorientation for pilots in active duty Air Force. So we're really excited about the projects that we're working on. And we do have, we're always coming up with more features and products. And one thing that I'm really excited about is our system has always collected data on how the patient is doing. And now with incorporating AI, we are able to automatically generate the therapy notes for the clinician. Our mission has always been making sure that the clinician is doing less admin work and spending more time with the patient. So now we are able to do that with our newer product to really decrease that amount of documentation time, increase the compliance, and increase the productivity of the therapist and reduce their burnout. Here, it gives you a quick overview of our how our AI works. So as a patient comes in, we collect all of the data, all the exercises that they've been through for that particular time, and then create the objective assessment and plan, which is pretty much the SOAP notes that the therapist has to write after a session, and we're able to just create it for them. Awesome. I just wanted to go through a quick video of one of our patients using the device. This was actually a demo at a location that we were starting to work with. They had a patient that's about in her 50s, early 60s, and had plateaued in her therapy. So we came in with our device just doing a demo, and she was able to go through about 3 to 4 of our applications. And this is her first time. Again, right side affected from a stroke, first time using virtual reality. She couldn't really hold the controllers in her hand, so we had to, use an ace bandage to make sure that she's able to, hold that controller in that hand. And she's working on one of our applications called retail therapy, where you have to extend your hand, flex your hand to pick up items off a grocery store. So we try to create applications that are very everyday living activities. So these patients in the end are able to go in and do these activities in real life. So you can see her, she's really working on bending forward, extending her hand as much as she can, even though she has a lot of tone and spasticity in her hand. But she didn't want to give up. She kept going and she was able to actually pick up a lot of items. And then the clinicians wanted to work on her weight shifting and movement. This is an issue with a lot of stroke patients. Once they have paralyzed on one side, they do not feel that side as much. So they're scared about putting their weight on that side in the fear that they might fall. So this is a really great app to work on that weight shifting. They start doing it on their own without thinking about it, which is magical to see. And next, the clinicians really wanted to work on her ambulation and distance goals that she has. And because of her stroke, she drags her toe a lot and is not really good at lifting her leg up. So you can see with her right leg, she is not able to actually lift it as much as she can on the left side. But by the end of about 5 minutes, she was actually lifting her leg a lot more, which is amazing to see. You can see that happen in a second. And this was 20 minutes. She was able to work on her upper extremity, work on her weight shifting, core, and then also ambulation. And I'm not sure if you're able to hear the sound, but she really wanted to like me to increase the difficulty uh, as we were working with her. Awesome. So I can end with a couple slides. We work with patients from like our youngest has been 3 years old. That was one of our clinicians that recently told us she had used a device with a 3-year-old, and our oldest patient has been 98 years old. So it's been amazing to kind of build these applications such that it can be used by somebody who's really young and going through therapy. And also, we work with a few cancer patients in their rehab, and also elderly patients that are working on, making sure that keeping that mobility as much as they can. I just wanted to touch upon one of the testimonials here. We worked with a patient who had a spinal cord injury, really young. He's in his 30s, but wanted to do as much as he can to be independent and not be dependent on his patients. So he worked on our retail therapy applications, our walking applications to, you know, reach out, pick up items, put it in a cart, and then one day he came back and told me that he was able to bend, like reach, pick up items from his pantry and put it back. And that's the first time he's been able to do it by learning how to do it in a safe space using our applications. So I can end here, happy to answer any questions.
Fantastic. Thank you, Vina. Testimonies like these, I assume this is what truly gets you going and pushing forward.
Definitely, and I still do onboardings. I still do demos with a lot of locations, and that when I go out there, see our clinicians using the device. That's what helps me get up every day, do what we do.
Amazing work, amazing work. Clive, do we have any questions for Vina?
Uh, yes, we've got a question which came in. Now you referenced a code that the therapists can claim. The question is, what is the level of reimbursement that the
Mhm.
therapist can claim using the that new code that you
Yeah,
referenced?
that is a really good question. We are tracking it as much as we can. Some of our customers have received between $50 to $75 on that code, and it is a per session code. So it's not exactly, in stone right now because it is a new code, but we have seen that ranges of $50 to $75.
Okay, okay. So with the also with the AI taking a lot of the admin drudgery out of the work
Mm-hmm.
for the specialists, with that aspect of that behind back office work speeded up and made easier,
Right.
is that having an effect on what the final cost is to the patients for the service that they get?
This is a new feature that we are rolling out right now. So we haven't seen any feedback from our customers. We're making what we're trying to make sure is that the note is actually exactly what they are looking for. And as we, get it rolled out to more of our customers, we can probably collect that data if that's trickling down
Indeed,
to
I
the
guess that's
patients.
the best way of doing it. Make sure that it all works
Right.
properly in the first place.
Right.
Yeah,
Yeah. And that's
great.
what we've
Thank you,
done with
Nigel.
our device. It's gone through so many iterations to make sure it works fine. And it's exactly what the clinicians are looking for.
Does
Amazing.
it give the patients the opportunity to do more work on their own when they're away from the
Mhm.
therapists?
We are working on that right now. We are doing a few pilots to send the devices home, and that's kind of been our mission to be able to give access to care wherever the patient is. So we're trying to figure out what's the best way to do that because we also have to make sure that there's in compliance with insurance and reimbursements. So it's a more complicated issue than you think, just sending the device home, but we're
Oh,
working on
indeed,
it.
indeed.
Yeah,
Well, if people need a Vision Pro and they cost a few $1,000s, it's
right. Yeah, it's not accessible. Yeah. Right now, we are using
Yeah.
only virtual reality, so not augmented reality at this point, but we're excited about the future of VR and AR being combined into one device.
That all sounds
Right.
very good to me.
Well,
I could have done with some of this over the past few years after a knee replacement, and just the problems of accessing some of the physio treatment. I mean,
Hmm.
I'm in the UK. We have the free treatment from the National Health Service, but access to
Right.
physiotherapy treatment seems to be guarded by now a whole line of private companies. So, and
I'm
anything
sorry
that
to
could
hear
make it
that.
more
Yeah,
accessible, I mean,
right.
there's a global market for what you're doing.
That is an issue here too. So we actually worked with a patient where this was one of our pilots that we did. We sent the device home and he had had a knee surgery and he didn't have access to traditional therapy because he could not afford it. And we got some really amazing results out of just 1 month. He was 50% weight bearing. That is, he was not able to put weight on that affected side. But by a month, he was walking in his house without
Wow,
an assistive device after using an app. So it definitely works. It's about figuring out the insurance reimbursement and how, to scale it up. Yeah.
absolutely brilliant, brilliant. Thank you,
Yeah.
Neva.
right. Keep up great work. Thank you for joining us. Fantastic innovation, and looking forward to seeing again soon. Um,
Thank you.
Next, we got Hossein Jalali. His talk will be about virtual app, brain training and assessment with VR. Hossein has nearly 2 decades of experience in digital innovation and successfully exited his first startup, FlexPacks, which was acquired by Urban Sports Club. Currently, Hussein serves as the co-founder CTO of Virtual App, where they combine virtual reality and AI to revolutionize cognitive science through immersive brain training. Another great innovation. Welcome, Hossein. Thank you for joining us and look forward to your presentation. Let me know if you're able to share your screen.
Hey there. I think I am, but my video is off. I think you need to turn that on.
Let me turn that on for you and ask to start the video so you can fantastic. And I can see your slides are coming up. So
Do you see me now? A
yes,
little
I
bit.
see you and also see your presentation. You can just put in your view on a slideshow, and I think we'll be good to go.
Okay, great. Well, first of all, thank you for having
Great, welcome.
us. Appreciate it. I'm going to start off by a little bit storytelling and then going into what we do and why we even decided what we've decided to build. With virtually around 40 years ago, people would, they would smoke in an airplane, they would not take care of their body, and when they would get sick, they would go to a doctor. Eventually, they realized, well, there's ways to maintain our body and stay healthier, stay more fit, and not have to see a doctor so soon. When the terminology wellness came into play. And wellness was basically the brainchild of a lot of the things that we see today when it comes to the different diets that we see, the keto diet, etc. When we see it in fitness, all the different fitness things that existed, but they became a lot more mainstream, like CrossFit, Pilates, etc. And all the wearables that we have, everything we wear, everything we do, a lot of those are towards wellness. They're all because of wellness. We want to stay and maintain a healthier physical life and have more visibility and transparency around it. However, when it came to the brain, we continued dealing with it the same way we dealt with it in the past with our body. We have no idea what's going on until we realized that things are getting pretty crazy. We'd go to a doctor and the doctor would tell us, well, you have Alzheimer's. However, a lot of these cognitive disorders, if found earlier, you can prolong the period in which they become much more serious. And that's what we betted on. With virtually, if we betted on the fact that we can provide more visibility, more transparency, and really believe that the next decade would be around brain health. and COVID really accelerated that. And we hear a lot more about the brain. We hear a lot more about uh, how to maintain it, the importance of mindfulness, etc. And so I think we fell on the right path at the right time. And so what we do is virtually been kind of giving you an overview is till now our companies, we've raised a little bit, we've had some sales. As a company, what we do is we create gamified experiences targeting different cognitive areas of a person and gathering a lot of data points on them, trying to understand what their cognitive state is today as we speak and what their cognitive state is over time, correlating that with medical information, being able to identify certain patterns that lead to certain cognitive illnesses, including Alzheimer's, including MS, etc. And so what we're trying to do is understand where you are today in terms of your cognitive state, in terms of an assessment, and then over time continue monitoring and being able to see change in a person. And I'll explain the change a little bit more. We also believe, why do we believe in VR? It's very clear, when you do an assessment with your phone, with a tablet, it's very different when the body is involved as well. When the brain and body are involved, obviously there's a lot more data to get. All neuroscientists will agree that the data is much more powerful. And being an understanding of, like, we even know that like posture has an effect on the illnesses that are related to cognition, something that you will not necessarily be able to get from a pen and paper model, a 2D model, but you could do it through VR perfectly fine. And so what we try to do is take advantage of what VR offers, how it gives you volumetric data. It gives you a ton of data around movement in terms of the posture, in terms of eye tracking, pupil dilation, a lot of things that can be taken from that. An example that we give that's not necessarily scientifically correct, but kind of paints an overall picture is that if you download a juggling app on your phone and you start playing it and you're the best juggler, you're nowhere close to being a real life juggler. But when you do it with VR, at least the brain and body together are working. And so you're one step closer to reality. And so it doesn't really paint the overall picture scientifically, but it does give an idea of what it means and what the power of using VR is, because we can really put you in an environment that we want to assess you in. You're not sitting, in your living room with a ton of different noises around you. You're basically immersed inside an environment that we've created. I can put you on top of a building and get your heart racing. I can put you in a dark cell and get you scared. So I can put you in an environment where I have control over you and then test you. And so what we try to do is take advantage of that. And build our games according to this information. These are some of the games that we have, each one targeting one different cognitive area. As Enhance, our first product, we have 15 different games, and I'll show them here. We have 15 different games. Each game is targeting, you can see, memory, attention, information processing. And when we talk about each of these categories, in reality, we're talking about a much deeper, thorougher category. So, and that's how the games are broken down to. So the game's not just broken down to memory, it's broken down to short-term memory, long-term memory, working memory. And in reality, we're targeting 21 different categories, each one under the umbrella of one of these seven main categories that you see here. Every time you play one of these games for 3 minutes, we gather somewhere between 80,000 to 300,000 data points on you. And our data is collected in three folds. The first layer of data is just gameplay scoring data. The second layer of data is data that we track around a person's events that are happening within the game. So if you use your right hand, did you use your left hand? Were you successful? Were you not? What was your speed in making that decision? And so much information that basically we can recreate your gameplay if we want in a 2D model, because every one of those events are tracked with a timestamp, so we can know exactly how you've played it. And then finally, we gather the XYZ coordinates of the controllers, the headsets, and the rotation of them. Obviously, that data, we don't turn it on everywhere. It's a lot of data. It could be a lot of noise, and it could be expensive. So we only turn that on for partners who want it. And just to give you a little bit of understanding, people play a game, we gather data, we check and we create patterns. An example of a pattern and an example of a change that we talk about is, let's say you have a memory game. We gather yes, whether you got the answers right or wrong. The most common change would be that you would always reach level 12, and now you're having trouble to even reach level 8. Obviously, that's a change in a person. We're looking for more subtle changes. That one, of course, but we want to see that everyone who plays memory games usually creates strategies. I'm going to go and get all the red ones first and then the blue ones, for example. And usually people, when they build strategy, they stick to it. So when you change strategy, that's a change in your behavior as well. So we identify that. We identify that you're being slower. We identify that you're making wrong decisions much differently than you used to. We identify that you started from the top corner now to the bottom corner. Now you're doing the opposite. And so when we say change, we're not talking about the most obvious one. We're talking about the ones that are not obvious. And then correlating that with medical information, it allows us to understand when someone has changed, what does that mean in relation to their health, and being able to turn that into a pattern that we can put back into our system and be able to early on tell the next person who's following that same pattern that you need to get checked. And so that's basically the overall of what we're trying to do. Do an assessment, give you an understanding, and then push you towards the right direction. And with that, we offer a cognitive assessment report to people. So once they play all our games, we give them a 20-page assessment that basically goes through every one of the cognitive areas that they've participated in. We tell them where they are versus people in the same age group, and what areas they're stronger and what areas they're weaker. How did we reach these numbers? And a lot of information, and that's given as a report to them. But what I do want to say is that while this all looks usable by anyone, we're very much a B2B company. We provide organization accounts. There's a backend for all of this where organizations can come in, create their own users and patients, and run through the model and have all the access to all the data that they want, first in a report that we provide, and also the raw data for them to take it and use it the way they want to. But on top of that, what we're trying to do is we are available free to play on all the different app stores. We're also available on all the different headsets right now. So we're kind of agnostic to headset, and we have somewhere around 70,000 users now who just download and play our games. Of course, the amount of data that they receive is less than what they would do if they came through an organization, but we do have that where it allows us to gather much more information and be able to put our games into a system that's working, and then removing the beta of it. And so we have some partners who are basically hospitals. We have research partners. We have a lot of different partners who are currently using Enhance for different purposes. Our second product, which is called CogniClear, falls under the same umbrella. CogniClear is basically a 30-minute assessment that will lead to telling you whether you have MCI, mild cognitive impairment, or not. And so that's the whole purpose of CogniClear, is to be able to take what's out there that's being done with different examinations, bringing it under one, and getting them to participate and play with this. On top of all of the games and the applications that we have in Enhanced, CogniClear, etc., we also have a tool for clinicians called the remote control, which allows them to be able to control the headset, the user, remotely. And this really saves them a lot of time, a lot of effort, and it really helps them with being able to basically get the user into that experience as quickly as possible with the least amount of knowledge in VR, because that's one of the trickiest parts of VR, is to be able to tell them, hey, you need to press that red button. They can't find the red button. You're spending 20 minutes getting them into the experience, and when they are, they're frustrated. They're not the same person. And that tool allows them, the clinician, to do all those things remotely, and so the person can just experience the experience. We're available for basically, as I said, B2B, but most of our clients come from pharmaceuticals, hospitals, clinics, education centers, elderly homes, corporations, insurances, In reality, when someone asks who needs this, we say every human will need this because you want to have an understanding of what your cognitive state is, and it's very difficult to get that. And there's a lot of taboo around it as well still. So this allows you to do it in the comfort of your own environment. We're a team of almost 18 now, and most of our team is based in Portugal. But our company is a US-based company. We have recently launched our late seed round. We've got 2.5 million already, and we have another 500,000 remaining. And with that, we're done. Thank you.
Great. Hussein, your product, your full product is available mostly to the institutions and hospitals. Is there a reason why you don't have the full product to the individuals?
To who?
To individuals?
No, well, we're available on the B2C store. We're available free to use by individuals,
Okay.
actually. We just offer them a limited number of reports that they can really receive.
Okay. It's great. And so gamifying this, it helps the user engagement and helps them to come back and get them more data, I assume.
Yes, it helps them, first of all, in the sense that you mentioned, but it also helps some people who are a little bit concerned and worried because mental health is a heavy thing to think about and to be tested on. And so when you get into the environment and you realize, oh, this is just, a small game I'm playing, it takes away some of that stress as well.
Yeah. Clive, do we have any questions for Hussein?
Hi, yes, well, there's one that came up, which was a question about are the benefits for people the same right across the board, or are there any particular conditions where individuals are getting more benefit from all of this than others?
That's a really good question. So first of all, yeah, it's beneficial for everyone because it gives you transparency. So when you have transparency, you know how to deal with something, right? So I wear a wearable that tells me how well I'm sleeping, that tells me how well I've moved, and just having that knowledge allows me to make better decisions. That's the first one. So it does help everyone across the board. However, there's two aspects to the question that you asked. One of them is our training aspect. In the future, we would like to prove that we are a tool that can help you be better. And when we say better, though, it doesn't mean that we're trying to make a smart person a genius. We're trying to make someone who has, who's smart at this level, stay at this level for a longer period of their life, right? And so our objective is not to make you something beyond what you're capable of. It's to maintain being as good as you are for a longer period. So for people who have had certain issues, I mean, we recently just did a study for university students who had ADHD using our tool, and it showed that it dampened some of the areas of concern. And so we do see that some people who have certain problems that relate to cognition are benefiting more visibly more, but it's basically good for everyone.
That's given me the idea that are there then people, does an individual person's attitude and frame of mind when they come to using this, does that have an impact on the effectiveness?
It does, and we actually have a study on that because one of the things that we ask every person when they start to play our game every single day is how many hours did you sleep and what's your mood today? Because we see that that has an impact, and we actually have a report on it as well with the number of people that have played, different people with different number of hours of sleep versus different mood have different results on that day. Yes, it does.
So people could benefit from working on their own frame of mind before they start taking part.
Yeah, we have a study out right now that not only that, but it also helps the frame of mind. It's also a helper, a booster as well. And we actually have a study on that with a partner that's coming out soon regarding how it benefits people who in the working environment as well, just running through our games once in a while.
Could that ever get to the stage where someone's able to kind of fix the results to cloud over the diminishing cognitivity because they're turning up with perhaps with a more positive frame of mind?
That's what we're trying to reach. If I could give you the answer to that right now.
All right, then that would be the benefit of it. Yes, of course,
Yeah,
right.
exactly. Our goal
right.
is to reach a point where we can help. Like I said, I can try to get you to your peak. I can't get you over that. That's the goal. That's an ultimate goal. That's something that we believe we can reach, but we have to do a lot more studies and we have to get a lot more certifications to really be able to say we can do it.
Indeed. Okay, thank you. Thank you very much.
No problem, my
And
pleasure.
with that, truly appreciate your time, Hussein. Great innovation, great work.
Thank you.
Great work, and looking forward to reconnect again. I'd like to thank all of you for participating and all the great speakers that we had. Look out for our next Bold series in the months ahead. And join us at our Bold Awards 6th edition in Lisbon, Portugal in March 28, 2025. That's our award ceremony, but the program is open, so you can reach out and submit your project to the company. Until next time, be bold, always take care. God bless. Take care.
Thank you. Bye-bye.
Thank you.